Are there specific medication guidance protocols for high cholesterol? If you are curious about whether there are specific medication guidance protocols for high cholesterol, you are in the right place. Let's break it down together. Yes, there are established protocols aimed at managing high cholesterol, especially focusing on lowering low-density lipoprotein cholesterol, often referred to as bad cholesterol. These protocols are based on clinical guidelines that take into account factors like patient age, cholesterol levels, cardiovascular risk, and how well a patient responds to treatment. First, it is important to understand that low-density lipoprotein cholesterol is the primary target for cholesterol-lowering therapy. Elevated levels of low-density lipoprotein cholesterol are strongly linked to atherosclerotic cardiovascular disease. Typically, treatment begins with lifestyle changes. This includes adopting a healthier diet, increasing physical activity, and managing weight. If these lifestyle modifications do not bring about sufficient results, medications are introduced based on specific cholesterol thresholds and individual risk factors. Statins are the first-line medications for high low-density lipoprotein cholesterol. They work by blocking an enzyme in the liver that produces cholesterol, which helps to reduce low-density lipoprotein cholesterol levels in the bloodstream. For adults aged 20 to 75 with low-density lipoprotein cholesterol levels of 190 milligrams per deciliter or higher, maximally tolerated statin therapy is recommended. In patients with diabetes aged 40 to 75, moderate-intensity statin therapy is advised regardless of low-density lipoprotein cholesterol levels. For those at intermediate risk of cardiovascular disease with low-density lipoprotein cholesterol between 70 and 189 milligrams per deciliter, moderate-intensity statins are used to achieve at least a 30% reduction in low-density lipoprotein cholesterol. If the goals for low-density lipoprotein cholesterol are not met with statins alone, additional medications may be added. Ezetimibe, a cholesterol absorption inhibitor, can be combined with statins to further reduce low-density lipoprotein cholesterol. This is especially useful if a patient achieves less than a 50% reduction with statins alone, or if low-density lipoprotein cholesterol remains above 100 milligrams per deciliter. Other non-statin medications may be considered for selected patients who still have high low-density lipoprotein cholesterol despite maximally tolerated statin and ezetimibe therapy. Treatment decisions are tailored to each individual. This includes considering the patient's overall cardiovascular risk, which is calculated using risk assessment tools. Potential side effects and drug interactions are also taken into account, along with patient preferences, cost considerations, and the ability to stick to the treatment plan. Regular monitoring of cholesterol levels and clinical status is essential to evaluate how well the treatment is working and to make adjustments as needed. Clinicians often use risk calculators to estimate a patient's 10-year cardiovascular disease risk before starting therapy. Shared decision-making is encouraged, where patients are informed about the benefits and risks of various treatment options. Lifestyle changes remains a key part of therapy alongside medications. The goal is to reduce low-density lipoprotein cholesterol by at least 30% in most patients, with higher reductions targeted for those at higher risk. In summary, medication protocols for high cholesterol are well defined, focusing on statin therapy as the foundation. Additional medications like ezetimibe are added when necessary, guided by low-density lipoprotein cholesterol levels and individual patient factors.